Hi, my name is Krista Martinez. I'm attending Capella University, Nurse Flex Path Plan 4030, and today we're going to be talking about remote collaboration and evidence-based care. Healthcare is continuously progressing to evolve, so all aspects of life can receive much needed care regardless of their location and availability. Incorporating evidence-based practice models for implementing new strategies to provide patient care to patients in remote areas can promote safe, efficient, and cost-effective outcomes for both patients and healthcare providers. These models are also very productive in the collaboration process so that the best care can be provided. In this assignment, we will discuss an evidence-based implementation plan for a parent of a child who has recently been diagnosed with cystic fibrosis living in a remote area an hour away from hospital care. We will identify effective strategies to promote optimal care by collaborating with a multidisciplinary team so that this patient can receive the best care despite her location. In this scenario, Caitlin, a 2-year-old child, has been admitted for pneumonia for the second time in the past 6 months. She's malnourished and sweat chloride test results were 65 milliequivalents per liter. She has been diagnosed with cystic fibrosis. The challenge is she lives in a remote town about an hour away. It is imperative that she receive proper care and monitoring because reoccurrence of pneumonia and risk for impaired gas exchange is likely to reoccur. The care team has decided to collaborate together with the mother of the child, Janice, via Skype to help guide her through the process so that optimal care is received. The plan of this discussion is to implement a multidisciplinary team to help patients and their families receive evidence-based care they need when living in remote areas via telemedicine to promote safety and quality care. When planning care for patients, it is important to regard evidence-based practice to improve safety and outcomes. Patients in rural areas find it difficult to receive the proper care due to geographical locations and may even prolong necessary care, furthering the disease process compared to those living in large cities. Telemedicine can help bridge the gap by easily providing healthcare services to patients in rural areas without the need for long-distance travel. Studies have shown that telemedicine has grown in popularity because of its improved connectivity with platforms such as Skype and FaceTime, making it easier for patients to network with healthcare providers and receive prompt, efficient care. The process of developing a care plan for the use of telemedicine for patients in remote locations such as Caitlin should be structured on evidence-based models. Evidence-based practice is important when planning care because it is associated with safer patient care, effective cost-saving measures, reliability, and consistency. To develop an evidence-based practice framework, the needs of telemedicine should first be evaluated. Needs must be patient-driven and cost-effective. In application to the scenario, the needs are defined by the possible reoccurrence of pneumonia or decrease in pulmonary function if proper care is not administered at home. Telemedicine could also influence the decrease of readmissions or unnecessary ER visits, making it cost-effective on not only the organization, but the consumer. Collaboration amongst a multidisciplinary team of attending physicians, home primary care physicians, nurses, respiratory therapists, dietitians, and caseworkers are the key component to successful intervention program because they all share separate interests in the patient's overall health. This collaboration strategy will benefit the patient because she has an open line of communication with different approaches to patient care. Challenges are access to telemedicine in Valley City. The PCP only has access to telemedicine in Cooperstown Medical Center. This can be mitigated through the use of Skype and keeping lines open with the PCP that are flexible until telemedicine access is granted for Valley City. In this scenario, Caitlin's care team was able to collaborate with an evidence-based plan of action to give the best care when she has to return home over an hour away. Qualitative and quantitative data must then be collected to determine the relevance and reliability of the evidence to ensure telemedicine has been tested and shown to improve some issues. Evidence regarding the effects of telemedicine in quality of life and cost effectiveness will now be reviewed. In terms of quality of life measurements using telemedicine, a study was conducted by Changmelexmi in 2019 has provided to be the most relevant study to consider when enforcing an evidence-based strategy for the use of telemedicine. This systematic review / meta-analysis showed that telemedicine significantly improves outcomes with a standardized mean difference of 95%. Although this case examines patients with asthma, the study of the effects of telemedicine and combined telemedicine with the use of multidisciplinary teams are momentous when developing evidence-based care plans. This study emphasizes the importance of having several medical support management for effective care. The study also noted that the duration of telemedicine for over 6 months was associated with higher improvements. This evidence could be the most effective when considering the quality of life that Caitlin can obtain when being cared for with cystic fibrosis when living in a remote location. The evidence is current and can be applied to different disease scenarios when utilizing telemedicine. To gain support from all stakeholders in the implementation plan, it is also wise to note the cost effectiveness supported by evidence to help influence the use of telemedicine. In a meta-analysis systematic review by Yu Kai in 2014, incremental cost-effective ratios of $491 to $29,869 per capita were noted for various telemedicine methods. This study validates cost-effectiveness when managing chronic diseases via telemedicine, such as telephones, Bluetooths, modems, mobile phones, wireless devices, and website usage. Telemedicine could also be cost-effective by early detection of pulmonary exacerbations, which could lead to hospital readmissions or unnecessary ER visits, not to mention travel time. Monitoring Caitlin's cystic fibrosis process via telemedicine may be helpful in distinguishing early stages of respiratory complications and lung infections. Now, knowing this evidence in relation to telemedicine, a plan of action can be implemented by tailoring healthcare services that are evidence-based to patients such as Caitlin who live in remote areas. Janice is currently meeting with her child's care team whenever she needs assistance. Open lines of communication that is person-centered empower Janice to be an active team player in her daughter's care. This care has been recognized as best practice when caring for children and their families. This communication enables the team to explore the parent's personal skill levels and emotional needs to help the care team design a care plan that best fits their needs. The team demonstrates this well by incorporating all modalities from proper respiratory treatment care to utilizing social workers so that the patient has maximal potential for exponential care. Collaboration with the hometown's PCP is also helpful in offering support in a remote location. All disciplines are in agreement to be flexible partners in offering care through telemedicine so that Janice can be less stressed in providing care for Caitlin and decreasing the chance of hospital readmission due to pneumonia or other complications. Challenges that Janice will face will be the lack of knowledge of care on cystic fibrosis. Caitlin is at risk for distal intestinal obstruction syndrome, pneumonia reoccurrence, and malnutrition, not to mention the stresses that she will encounter with the newly diagnosed disease. Janice should be educated on these matters so that early detection could prompt early intervention. Importance of taking pancreatic enzymes with adequate fluid intake should also be provided to help reduce the risk of DIOS. The dietitian could help develop a meal plan option that are high in protein, calories, and fat-soluble vitamins. Chronic lung infections are increased by the thick mucus in the lungs that promote bacterial and fungi growth. Importance of infection control through hand hygiene, vaccines, and proper cleaning techniques of chest physiotherapy devices are vital in decreasing chances of infection. Studies have shown that understanding lung diseases early in life related to lung structure, physiology, therapeutic options, and prevention strategies can help influence intervention at appropriate times. Janice also needs support for her emotional well-being. Her town does not possess many resources. Empowerment will be fulfilled by information reference supporting her during this time of raising a child with cystic fibrosis. Since online capabilities are available, one such resource that is easily accessible is the Cystic Fibrosis Foundation. This offers a plethora of information and instructional videos regarding infection control, families and their experiences, proper nutrition, disease processes, and also references for assistance services to help with finding counselors, financial aid, and insurance issues. This is an easily accessible reference that Janice can use to help support her in addition to the exceptional care that she's receiving. This type of decision-making not only is analytical from research stated previously, but also intuitive, considering a patient's emotions and empowering them with exceptional evidence-based care with accessibility of telemedicine can promote quality of care that will not only benefit Caitlin and her mom, but others in remote areas that are in similar situations. From this scenario, we can learn and continue to evolve a plan of care with the evidence to provide many other patients in remote locations. Thank you very much.